Tonight, we began a two-part watchdog report looking at how your tax dollars are being used when it comes to health levies.
To set the stage, health levies are rare in Ohio. Currently, there are 6 medically related levies in the state. Of those, 2 in the Mahoning Valley.
Now, for 48 years, Mahoning County voters have approved a levy for tuberculosis. And for 44 years, Columbiana County voters have approved a levy for a cancer clinic.
The Columbiana Cancer Clinic levy is the only one of its kind in the state. Mahoning County's TB levy is one of 5.
So why are our local levies such outliers? Are they even needed? Sydney Canty has part 1 of our Watchdog report that looks closer at Mahoning's TB levy. Sydney.
Well, Derek, Madison, there's no question that health services for TB are needed, but 95% of the state provides these services without levy funding. And with TB cases mostly at bay, why does Mahoning still need the levy?
At the beginning of the 20th century, tuberculosis was the leading cause of death in the U.S. with no treatment or cure. Valley newspapers told stories of hundreds of deaths. And that's why Ohio law requires that every county have a TB plan. While TB still exists, it's much less of an issue. Mahoning County provides their treatment through a TB levy, last renewed in 2022, bringing in more than $1.2 million every 5 years. Most of Ohio's 88 counties have come up with other ways to fund treatment. Mahoning is one of 5 counties still using a levy.
We're a completely different society where maybe it flourished 150 years ago. You don't have that in this country anymore.
Mahoning Health Commissioner Ryan Tekak tells me prevention is key. It's geared towards people with latent TB who have no symptoms and are not contagious.
Our program's designed to actually identify those who are latent and then for those individuals to start undergoing treatment of latent TB. If you're not treating these blue cases, these latent TB cases, 10 to 15% have the potential to be active TB.
That treatment is, providing the medications, the chest x-rays, the case management, the blood work, and then seeing our TB medical officer.
Between 2019 and 2023, Mahoning County had 138 latent cases, with some still being treated today. TCAC says without the levy, they wouldn't be able to provide that level of care.
The prevention piece of it would be very difficult. It's not just a one-time treatment. It's a couple months of treatment that individual has to go through, which is all covered under our Mahoning County TB program.
Other counties I spoke with do not treat latent, saying it's not an active concern. Stark County doesn't have a TB levy, and their program costs $16,000 per year. Unlike Mahoning, they will bill your insurance. It's a formula that's been working for decades, and they haven't had an outbreak. So when I asked TCAC why the levy is still needed, he reiterated that he felt preventative care was important. So how is the money used? Looking at year 2019, 1/4 was spent on testing and supplies. 3/4 went to salaries. TCAC says the cost to taxpayers is extremely low for the services. Lorain is another county with the TB levy, although their health commissioner is not convinced they even need it.
For us, there would be no reason to actually keep it going. We have that funding mechanism to be able to support doing the tuberculosis program, which would end up saving the citizens in the county, at least in Lorain County, it would end up saving them money.
And Lorain does this by using general fund dollars and billing insurance. So are these levies still needed?
When it comes to, you're looking at 3 or 4 cases per year, really those individuals that you have on staff are already doing other work that's public health related with so many other infectious or communicable diseases. So it's just that you just wrap tuberculosis into it.
Now, the Mahoning County tuberculosis levy will be back on the ballot in 2027. Tomorrow, a Watchdog report taking a closer look at Columbiana County's cancer clinic levy. It is the only levy of its kind in the state.